and ask you to welcome the first team, who are from the Netherlands.
Okay. Who's the team leader?
I'm the team leader.
Hi.
Yes.
Here.
Sorry.
Okay. Welcome to your CPR scenario. So I'll give you the scenario, and then you tell me if it's everything okay, and then we start.
Fine.
Okay. You have been called urgently to review a patient on the surgical assessment ward.
Surgical assessments, yes.
Mary was admitted last night with abdominal pain and urinary tract infection. She's unconscious and has patchy skin. Mary requires an immediate review. Is everything clear for you?
Yes, it is clear.
Yes?
Do we know the age of the patient?
She's 60.
60 years old. And do we know any past medical history, or this is
We
old
don't have any
information?
medical history.
Okay, good.
Okay, ready to go?
Okay. So we go with an emergency team to the ward, to the
Okay.
surgical ward.
We start.
Okay. Girls, I want to brief you, or you just heard it. We have Mary, it's a surgical patient. She was just admitted last night. She's 60 years old. She was admitted because of a urinary tract infection and abdominal pain. And we are now being called because she's unconscious and she has patched skin. So let's check her ABCDE, okay?
Yes.
To the vital rules, Jennifer, can you be, if we have loss of circulation, be the circulator, connect the monitor?
Yes, of course.
Hilde, can you help me with ventilation?
Yeah.
And can you, if we need, perform CPR? So first I check in the A, or I address the patient.
She doesn't answer.
She doesn't answer. Can you do BLS? thing?
Hello.
Hilde, could you switch on
No
the
response.
oxygen
Look,
for
listen,
me?
Phil. 10 seconds.
I turn on the oxygen and I connect it to the ambo.
Right.
Guys, I have no breathing.
No normal breathing.
I start with CPR.
Perfect.
Okay. Continue
So, Shelley,
CPR.
can you count when you're approaching the 30? Oxygen has been connected. It's perfect like this. Very
Okay,
good
guys,
depth,
get ready for
good
the quick look.
frequency.
28,
what is the
29,
CO2?
30. We don't have it.
Yes,
Okay.
I feel the breathe.
Stop CPR.
I don't see anything. I have no pulsations.
Oh,
Is it
okay.
connected?
No, it's not connected.
Okay, continue
Go on,
CPR.
yeah. I don't know.
As soon as it's connected well, we do another quick look, Jennifer. Very well,
This is not
Marika. Can
connected.
you count when you're approaching 30?
Jesus.
Rust. Very good. Very well. It's a good depth, good frequency. Try not to be too quick. Perfect. Hilde is preparing material for intubation.
Okay, guys, get ready for the quick look. We don't have a CO2. Stop CPR.
I have no pulsations.
I have no pulsations.
We don't see rhythm.
Oh, this. Is it right?
I think we have a technical problem here.
Yeah.
I'm ready for intubation.
All right, we are
Where
going
is
to
the-
intubate. So, Marike, can you call for technical assistance because the defibrillator is not working well?
Okay.
Tube.
Almost get ready for the quick look. Stop CPR.
Wait, tube is not fixated.
Okay, I don't have an.
Let go.
I don't have it.
Okay. So can you connect the oxygen first, please?
Sir, can somebody help
Very
me?
good, Marika.
Oxygen is connected.
Okay, can you
We have,
fixate the tube?
we have a problem. I don't see a rhythm.
We just continue, girls.
Ah,
First.
no, I need the pads.
All right. I have my stethoscope here. Okay. So interrupt chest compressions.
Good job.
Yes,
Is it
continue
connected?
CPR.
No.
Tube is in the right place. We have bilateral breathing sounds.
Release
Can you
the
count
pads.
every 10th
Okay.
compression?
Okay, for now. Another. Get ready for the quick look.
One more
So,
minute.
what is the CO2? No. Stop CPR.
Tube is fixated.
I see
No pulsations.
no pulsations. Okay, stop CPR. Of continue,
Continue CPR.
Yeah. I charge
can
with
take over.
200 joule.
Perfect. Tube has been fixated, Jennifer.
Okay, the tube is.
Can you count
Okay,
every
stop
10,
CPR.
Michelle?
Clear all. Okay, clear all. Continue
All right,
CPR.
girls. things went a little bit differently, but let's say we're now in the first block of a shockable
10.
algorithm.
Okay, we have IV.
Good job, Richelle.
Jennifer, we're in the first
Go
block
on.
of shockable algorithm. We saw
10.
VFib.
Yeah.
That means we're not giving any medicine now, but
I want
in
to
the third
connect
block
the
you can
CO2
give
cable.
300
10.
milligrams amiodarone and 1 milligram adrenaline.
Okay,
But
I
not yet.
repeat, 300 milligram amiodarone and 1 milligram adrenaline.
10. Exactly. Chest
Come on,
compressions
Richelle.
look well.
doing
Ventilation is
great.
working, Hilda.
Ventilation is going
Do we
well.
have a patient
Where's the
file?
medication?
Come on.
Can I find any more about this patient? Do we have a computer with a patient file? Is there medical
10.
stuff around?
There's no medication.
Is there anyone who knows
Good
more
job.
about
Come
this
on.
patient?
You can
Is
do
there a
it.
nurse around? Or?
Because of abdominal pain.
Okay.
10.
Yeah.
That's it.
Okay.
Okay, keep going.
So we don't know anything more about this patient.
10.
So I like to proceed to the 4 H's and T's already. This is what we have. Hypovolemia or hypoxia to start
10.
with. We didn't see any problems of breathing, but we cannot be sure that's not the case. But we are treating that with
10.
100% oxygen, 15 liters at the moment. So the hypoxia is being treated. If we proceed to hypovolemia, I don't see any signs of external bleeding.
No, you don't see anything.
Internal bleeding, I feel the stomach. Is it distended? Is it irritable?
bit.
A bit. So what I do next is I want to call the surgeon to examine the patient with me and to check if there's any sign of internal
on.
bleeding.
Wow.
Can I call the surgeon? Is he coming?
He's coming.
You're doing
Okay.
great, Richelle.
It's not a trauma patient. She didn't
No,
fall or anything.
she's not.
Okay, so we don't have any sign of external bleeding, internal bleeding. We're trying to cover that.
Guys, get ready for the quick look. What is the CO2?
Sorry?
What is the CO2?
It's 20.
20. Okay, so we have suspicion for ROS.
Okay, stop CPR. No pulsations. I see-
Shockable rhythm.
No pulsations.
Shockable. Okay, continue CPR.
Perfect, girls.
Charge with 360 joules.
Kom op.
Okay, stop CPR. Clear all. Continue CPR.
Kom op. Kom op.
We are performing fluid resuscitation at the moment.
Okay, you give the IV.
Jennifer, are you feeling under pressure?
No, not yet. Do we have a pressure bag?
Okay.
Dieper, dieper.
Sorry?
We
have
put
a
a pressure
pressure
bag
bag?
Yes,
to
we
feel
have.
under pressure.
Okay.
Did we already send lab for IV testing?
I will do now.
Okay, hypovolemia. So we're performing fluid replacement at the moment. I don't have any signs of an internal bleeding yet, so I'm not ordering blood yet at this moment. But as soon as the surgeon arrives, maybe I need
thank
to
you.
order blood. I proceed to the hypo and hyperkalemia or other electrolyte disturbances. Do we have any lab results yet?
No, it's not moving.
You can give you some
great.
blood test for
Okay.
hypokalemia. Okay, we
Yes.
wait for the result.
Yeah, we wait for the result. We proceed to the hypo and hyperthermia. I check the temperature of the patient. What is the temperature?
36.
36, no abnormalities there. So we proceed to the T's. Cardiac tamponade. Do I see the standard neck veins?
The neck veins are empty.
Okay, I will still call the cardiologist
Iets hoger.
because I
Keep going.
cannot exclude the cardiac tamponade at this moment. So he can also have a look at
And a lot of
abnormalities.
Yeah,
Perfect.
Some IV, extra IV.
Okay, the cardiologist is coming.
Okay,
I'll worry
guys,
with the time.
get
Thank
ready
you.
for the quick
Can you
look.
check with me the
What is the CO2?
pulsations? Kom op. Nog even.
35.
Ik weet niet zo goed waar ik me moet
Zal ik
focussen.
35.
35. The CO2 is 35.
Okay, so we have a suspicion for ROS.
Kom op.
Okay, stop CPR. I have narrow complex tachycardia. Do we have pulsations?
No,
No pulsation. Continue CPR.
No, there is pulse.
there is pulse. Okay, so
Stop
stop
CPR.
resuscitation.
Okay.
We have ROSC. I'm going to check the patient from A to E. Hilde, can you maintain ventilation?
I will.
Can you
We have
switch
to
on the
press
monitor
stop.
sounds and help me with the vital parameters?
stop.
And Marike, can you perform an ECG and call for a chest X-ray? So I will check again from A to E. I have a secured airway. The tube is condensed, so no problems with that. No suspicion for cervical spine injury. I proceed to the B. Do we have a saturation?
The
you
saturation
feel the
now is
pulsations in the
95.
95. I'm happy with that. We're still treating with oxygen. I look at the neck. No injuries there. No
Ik niet.
distended neck veins.
Can you check that?
Is the trachea midline?
Midline.
It's in midline. Then I proceed to the chest. I don't see any injuries. What's the frequency of breathing?
Sorry?
What's the respiratory rate?
No, he's breathing with the hair
Okay,
out.
good.
Okay.
So I will listen then.
Okay, normal sounds, normal
Normal
sounds,
sounds.
normal sounds, normal
I see a
sounds.
normal depth of respiration.
Yeah.
Okay, so no abnormalities there. I percutate. Do I hear hyperresonance or dullness?
No, it's normal.
It's normal, okay.
The chest
So we
is
have
normal.
not a B problem. We proceed to the C. What is the heart rate? 78. What is the blood pressure?
The blood pressure is now 100/50.
Okay. I'm happy with that also at the moment. We're still giving fluid replacement. I still wait for the surgeon. I check the abdomen. I check the skin.
It's tense. The abdomen is tense.
It's tense. Is it more tense than it was?
Yeah, a bit more.
A bit more. So I still want to order blood, and I don't know what's going on, but I want to order 2 units of non-cross-matched blood. Although the blood pressure is quite normal, but I'm not sure. I check the peripheral pulsations. Can I feel them?
Yeah, you can feel it.
Okay. So then I proceed to the D because we have IV access, and we did send blood for the lab.
Okay. The scenario, you can stop it.
Yeah. Over
Okay.
here.
Okay.
Okay.
Thank you.
Is this echt zo good? But good.
So, thank you. Thank you again, Dutch team. Whoa. I'm looking at the team leader now first. What's your name, team leader?
Lottie van Baal.
Lottie.
Yes.
Lottie, there were a few issues there at the start.
Yes.
Let's talk about that first.
Yes, the defibrillator, it was not possible to connect the defibrillator in the right way. So we had a technical problem, which of course can always happen, as well in Bologna here as in normal life, daily life in the hospital. So I think we solved that well by just continuing CPR because that's of course the main contributor to maintain the circulation.
Yeah, I noticed that you had good communication within your team, and I find it particularly interesting that you have kind of different roles assigned in colors. Let's see that for the audience, yeah? Very, very nice circulation. Supervisor, ventilation?
Ja, ventilator.
Ventilator,
Ja.
CPR. That's very clever. I think there was an issue with the initial electrodes. So we will take that into account whilst giving the marks afterwards. So that is not your fault. Yeah, okay. Yeah. But you handled well. Yeah. There was another issue with, once the right electrodes were on the chest, there was another issue that I saw. Do you remember? It's with the kind of blank screen, and you didn't have the right channel apparently. Did you see that?
I thought it was actually a connection problem.
To connect the pedals or something else, and that
You
was
have
the
a
problem.
microphone.
Yeah.
Yes. Say it again.
There was no connection with the pedals on this side, so it was not on the screen. We don't see the rhythm.
Did you find out what was wrong?
The connecting was not yet. It was.
She's the circulator.
Yes.
There was another pad inside the life bag, so There were 2 pads. Yeah, I think so.
Yeah. But
These pads.
Yes. I think there was 2 issues. I noticed. One is the wrong electrodes. It's kind of a wrong electrodes were in the package.
There was
so that is our problem.
Okay.
So we'll not hold that against you. But the other thing is that the right lead wasn't selected properly.
Yeah.
I thought. So it should have been put on pedals earlier.
Yeah, but we don't see that because we changed from pedals to look what was wrong. So I think you have to return back on the pedals.
Yeah.
When the right connector was okay.
Oh, yeah.
I think so.
So that was a bit complex.
Normally here start with rhythm. Normally you don't. We have we work with this in Holland, so we have the rhythmation with the Life Pack 15.
You say it's because of the change of the electrodes.
Yeah.
Okay. So we'll take that into account as well. There is an interesting comment from the audience. Well,
maybe we can give
do we
the
have time
microphone
for Robin? Do we have time for comments from the audience? Just one. Can they?
She can.
You think it's
She
interesting?
was allowed to talk.
Okay. Any conflict of interest? Dutch? Yeah?
Yeah, well, actually, I'm here. They're trainers. Well, the thing is with the live pack, if you disconnect the pads, it will automatically search for the lead 2. If you connect it again, you have to select pads again. So normally, when you start up the live pack, it selects pads. So because of the pads were wrong, it will immediately go over to lead 2. So actually, they couldn't help it.
No, that's what I mean.
Sorry.
Yeah.
Thank you. I'll take that as your opinion, a conflicted opinion.
You can
Okay.
test it.
Okay, team, you were the first. The first, sometimes difficult. It was by chance that you are the first. Well done, you landed on your feet by good team leadership and by very good collaboration. Okay, give them an applause.
Thank you.
Okay, thank you. Okay.
Okay, ladies and gentlemen, so the second team in the CPR competition this afternoon are from the Czech Republic. Please give them a warm round of applause.
I am team leader.
Your CPR scenario.
Thank you.
We'll give you the scenario. Okay, welcome to your CPR scenario. I will give you the scenario, I'll give you the information, and then you tell me if it's everything clear, and then we start.
Okay.
Okay? So, you have been called urgently to review a patient on the surgical assessment ward. Surgical assessment ward.
Assessment ward.
Okay? You have been called to assess the patient. Mary, she is the patient, was admitted last night with abdominal pain and urinary tract infection. Okay? She's unconscious. And she has a patchy skin. Mary requires an immediate review. So you have been called.
Okay, the patient is Mary.
Yeah.
How old is she?
She is 60.
She is 60. She is admitted for the pain, abdominal pain, and urinary infection.
Yeah, exactly.
Yes, and that's all. And we are in a hospital.
Okay. Okay, ready?
So can we have a small briefing before or not?
No, if you want, you can have, and then we start.
Okay, guys, so you are my emergency response team. So if we have some problem, I will call you. And Michal, please care about the ventilation or intubation if we need it. Vašek, please care about the monitor or defibrillation safe. Please good quality compression, and you will change after 2 minutes. And please, Pavel, guard me the ALS algorithms with me. And also, please, maybe we will consult anything else to other specialists and so on. Okay. So everything is clear for you?
Yeah.
Everything is clear? So can we start now? Okay, yeah, so start. So, Mary, can you hear me? No response? Any breathing? Any chest movement? Any pulse?
No pulse.
So we have cardiac arrest, boys. Please, the patient on ground, and we must start CPR.
Okay.
Zdenek, please, please compression. Vašek, put self-adhesive pad, and Michal care about the ventilation. Okay. Please, the first use the back mask ventilation and 2 to 30 for the first time.
6, 7, 8, 9.
So if you have any problem, please tell me. So there is lead 2. Please push lead paddles. Yes, push lead pads. Lead. Okay, paddles. Yes. So stop compression. So I see VF. Please start compression and make defibrillation 200 joules.
So I charging 200 joules. Everybody stay clear except Zdeněk. Everybody stay clear except Zdeněk.
Staying clear.
Charging. So stay clear. Shock delivered.
Yes. Start compressions, please, Zdenek. Insert the IV line to the patient. So what we know about the patient? So we know that she is 60, and what
20.
about the medication? And what about the some illnesses?
We don't know anything more. We just know she arrived to emergency room because she had abdominal pain. And that's it, all we know.
And that's all.
Yeah.
And so we haven't any blood analysis.
No, nothing.
Nothing.
in the
Okay,
chart.
nothing.
Intubation.
IV line is ready. Please slow infusion of balanced crystalloid.
Nine.
And
Intubation.
intubation. So, Michal, please prepare for intubation,
Okay.
and then Pavel help the Michal. So, how is the time to another
Which size
analysis?
do you want?
Hello, time.
Which size?
Time.
10.
Time, 1 minute.
1 minute to another analysis. Okay.
7, 8,
7.
9,
7.
10.
Okay.
So compressions are okay.
Chest rising.
The chest is
rising.
compressible.
Okay.
Okay. Yeah. And ventilation is also okay.
Yeah.
Yeah. Okay.
10.
Which time to analysis?
1 minute and 50
10.
seconds.
50
Sorry.
seconds. Okay. 50 seconds. Please continue with good quality compression.
30. Chest.
And do you have stethoscope? Yeah, of course. So
She's
I'm
normal,
ready.
about
Maybe the
60
next
or
cycle?
70
Next cycle,
kilograms.
Next cycle, okay.
Yeah.
Normal. Okay.
30 seconds.
20.
30 seconds to analysis.
Just make it ready and the next cycle.
Ten.
10 seconds.
20.
5,
9. 30.
4, 3, 2, 1.
So stop compression. So still VF, please continue with compression. Another defibrillation, 300 joules.
So
please.
I charging 300 joules.
And guys, so you will...
We are ready.
in the
Charging.
Okay.
Everybody stay clear except Zdeněk. Everybody stay clear
Standing
except Zdeněk.
clear.
Don't be afraid. Don't be afraid. Charging. Stay clear. Everybody stay clear. Shock delivered.
Continue compression. Okay.
Okay.
In this cycle, please
Here
intubate
we
the
go.
patient.
Laryngoscope.
And I was it's time to think about the 4H and 4Ps. So the hypoxia, so we solved the hypoxia now. So Michal has the oxygen 15 liters. So we try to
fix
use
it.
this 100% oxygen. Then hypovolemia. Can I see some blood maybe between...
Infusion's ready. Infusion's ready.
You don't see any blood.
Okay, stop compression.
Externally, you don't see any blood.
Externally, I don't see any blood, okay. And we didn't know before else about
No
anything.
sounds.
We don't know nothing, okay.
Okay,
This is hypoxia, hypovolemia, some metabolic disorder with haven't any blood analysis.
Jana, array secured.
Okay,
Infusion
and
is good.
it's equal?
Equal both sides.
Okay, in
ventilating.
both sides. Hypoxia, hypovolemia,
Sorry, Jane. Infusion is go.
small infusion, please, small infusion, slow infusion.
I don't see.
Yes. So, please, some blood analysis. I would
1
like
minute.
to go some minerals and so on, because we don't know about
Okay.
the patient anything.
And
Yes,
can
blood-
I prepare the pharmacs? Adrenaline?
Yes, please
amiodarone?
prepare 1 adrenaline, 1 milligram adrenaline, and 300 milligrams of amiodarone for
Yes.
the next cycle. Yeah. So hypoxia, hypovolemia, metabolic disorders, and hypothermia. Temperature is okay, please, and maybe look for the temperature. Yes, the panel temperature will be better. So, and tension pneumothorax we excluded because
30
the
seconds.
sounds are equal on both sides. Tamponade, is it ultrasound?
If you want, you can use it.
Okay, Pavel, please then call the specialist for ultrasound. Yeah.
For ultrasound.
Okay, toxins. Is there any
Various things.
medicaments in the pocket or so?
There is no ATCO2?
No ETCO2. So we would like to ETCO2, but we don't see in the monitor this.
No, we
so,
don't see.
So, and the value of ETCO2 is now?
Sorry?
Which value is
20.
5, 4, sorry, 3,
Sorry?
2, 1.
Stop
Analyzing.
compression, stop compression. This is the VF, continue. Oh, no, please. Can I feel the pulse?
You don't feel the pulse.
Don't feel the pulse. Please start compressions and give the patients 1 milligram of adrenaline, please.
Tady, adrenalin.
So, and I call the specialist
Yes,
for
call the specialist, please.
sonography.
So the tension pneumothorax tamponade we will have the
So
specialist.
I would like to call the
toxins.
specialist there
Yeah,
for
sure.
sonography. And
Toxins
where
and-
we can be there? When we can be there?
2 minutes till we'll be here.
2 minutes. Thank
Okay.
you.
Toxins, we didn't see any medicaments and okay, thank you. And thromboemboli is also possible because abdominal pain is also maybe due to myocardial infarction.
1 minute,
So
30
we will
seconds.
continue. Okay, 1 minute 30 seconds. We will continue with resuscitation.
So what are you looking for?
So ventilation
I'm
is
again
okay.
looking for ATCO2. Ventilation.
Michael.
Michal, compliance is
Yeah.
okay. Okay.
Ventilation's fine.
Compressions are
Compression's
okay.
good.
Okay. So push hard, boys. Yeah.
Yeah.
Okay. So the specialist is in now.
Now it's in, if
So
you want.
what about the ultrasound? What
1
can we
minute.
see on the
1 minute.
heart?
The heart is okay, no fluid around the heart.
No fluid
No
around
fluid.
the heart, and can we see something maybe in abdomen?
No,
Maybe
you don't
blood?
see
No,
anything in the
no,
abdomen.
No, okay. So maybe thromboemboli is probably the relevant causes. So which time to
40
analyze?
seconds.
40 seconds. How is the value of ETCO2 now?
Is 20.
20.
30 seconds.
So slow infusion, please. Slow infusion. Slow. So which time?
20.
20 seconds, okay? So good compression.
10 seconds. 5, 4, 3, 2, 1.
Stop compression, please. I see the organized rhythm. Any pulse?
You feel the pulse.
Yes, I feel the pulse. So stop CPR, boys. Now we will continue with initial assessment A, B, C, D, E. So A, the airway are secured. It's okay. So is there any spontaneous activity breathing?
She start to have some breathe.
Start to have to breathe. So please continue the assist ventilation according to ETCO2. So can I hear anything?
Yes, normal
This is
sounds.
Normal sounds. This
Normal
equal on both
sounds.
sides. Okay. Please, yes, SpO2. Any trauma?
No, no trauma.
No trauma. SpO2 is now?
Sorry?
SpO2.
95.
95. So maybe it's on the border. We will continue with maybe we can lower the oxygen. So it's B. We will continue with C. Please 12 lead ECG on the chest. Can I feel the pulse peripheral?
Yes, you feel
Yes. Capillary refill time?
3 seconds.
3 seconds. Okay. Please, and then check blood pressure after the 12 lead ECG. After this, yeah.
Yeah, oxygen lowering.
Oxygen lower. Okay. So, I don't see any blood.
No, you don't see
yes,
blood.
I don't see. Can I see maybe some signs of thromboembolism?
No, the legs are normal.
No. Okay. What about the 12 lead ECG? Is there any signs of
No.
myocardial infarction?
No ischemia, nothing.
Okay, so maybe I need now blood analysis, blood gases, minerals, and maybe hemoglobin and other this. Is there any interesting in blood?
You have to wait for the results. But
Okay,
they started, but you are not, you have not results.
Okay. So we will continue. C is now we finished. C we will continue with D. What about the D pupils? Are reactive or not?
Not reactive.
Not reactive. And is there any response to pain?
No.
No response to pain. So we will continue with post-resus care. Please glycemia. Now with analysis we need.
Gina, abdominal is hard or?
Yes, in abdomen there was no signs.
Sample
and
of
also on the-
glycemia.
Yeah, thank you.
Sample of glycemia. I
Okay,
don't know.
glycemia.
Okay, it's normal, 70.
70, okay. Now we
Wait.
will start with temperature target management of the patients, and now So, do you have some idea, guys?
Can I get out the dress?
Yes, please get out all the dress. And
Okay.
can we see anything?
No, you don't see anything special. The legs
Any-
are okay,
anything
no
special,
average.
everything is okay. Yes, okay. So the TTM now, and we will consult maybe intensive care unit to transfer the patients because we don't know what was the origin of the cardiac arrest.
Okay.
But we try to exclude all reversible causes, but we didn't find anything.
Okay. Okay, we
So,
end the
thank
scenario
you.
here. Thank you very much.
Thank you, guys.
Just
Yes. Yeah.
Czech team. Well done. What's your first name, leader? Jana.
Jana.
Jana. I had the impression you had good control. What were your feelings with this performance?
Exhausted.
Yes? You're exhausted. Anything else?
So thank you, team. Thank you, team. I think
Very
the
good.
boys are very good.
Can you hear her?
So,
Yes?
can you
Okay.
hear me? Okay. I don't know what's happened. So it's a little stressed me because we try to find the problem and we didn't find it. But so we will see.
Yeah. I noticed that you put the mannequin on the floor.
Yes.
Is that your usual approach?
Usually, yes, because we are from rapid response team, we are from emergency medical service, and we usually resuscitate the patients on the ground. So for us, it's a much more friendly than to resuscitate the patient on the bed.
Okay. There's always the balance between risk, losing time, but you were a big
Yes,
team.
yes, but I think it also depends also on the physiology of movement because I think the best compression or the better compression we will do on the ground because we do it all the time.
Okay. Yeah. You very quickly assessed and took control. Do you remember? You very quickly assessed as a team leader what was wrong with the patient and got your team going. You remember that?
Yes, I asked about the breathing, I asked about the pulse, and the answer was that there is no breathing and no pulse. The patient was unconscious, so I decided, because the time is usually, the best time is to decide it to 10 seconds maximum, so I try to do this because we haven't any time, and if there is a possibility to make a safe defibrillation, so if the defibrillation will be very soon, it's much better for the patient.
Okay. Do you or your team have any concerns about what happened in this scenario? Any concerns you like to share?
Oh, Jana is the good team leader, so I don't be afraid with her.
Good communication as well?
Yeah,
We try to.
we are
Okay.
used to.
Any other thoughts before we close this?
So the abdominal pain, there are many. So due to this, I also ask for ultrasound because the first I suppose maybe some bleeding to the abdomen. So maybe the causes will be hypovolemia, but there is no signs of bleeding. So maybe the abdominal pain is also sometimes very close to the chest. So abdominal pain is if the patient has inferior infarct, sometimes they have abdominal pain. So it was the other reason.
Sepsis maybe?
Also, yeah. Yes, I also think about the sepsis.
But
Yes.
that's hypovolemia.
Yes, but that's hypovolemia. Yeah.
Okay. Very good approach. Czech team, thank you very much. Hopefully we will see you again in the finals, but we don't know yet, of course. Thanks very much. Applause.
Thank you.
So, ladies and gentlemen, sorry to say that the Norwegian team haven't been in contact, so they're a no-show and therefore disqualified from the competition. We will reconvene as programmed. The next time team that will be up will be Turkey. We'll see you later.